Join SAMHSA's Gain Center for the Early Diversion virtual learning community. This series will cover 5 topics via webinars, small discussion groups, and supplemental resources. Topic 1: Engagement Challenges. Many communities face challenges engaging certain individuals in treatment. These individuals cycle through homelessness, incarceration, and crisis services. While there is no one-size-fits-all approach, there are specific strategies, services, and practices that communities have developed to address the service needs of these individuals. In this webinar, presenters will address multifaceted approaches to improve individual outcomes and system response. Topic 2: Housing. Housing is a critical need for individuals who participate in early diversion programs. Services alone cannot address the overwhelming disruption homelessness contributes to well-being and health. In this webinar, presenters will address comprehensive strategies to overcome barriers and improve housing access for homeless individuals experiencing crisis or in contact with law enforcement. Topic 3: Forensic Assertive Community Treatment Teams. Forensic Assertive Community Treatment, or FACT teams, are well-researched and effective programs for individuals who are justice involved, many of whom are experiencing homelessness and are involved in multiple systems of care and support. Access to FACT teams is sometimes limited due to funding or functional requirements. In this webinar, presenters will provide an update on FACT research and discuss approaches to funding, criminal justice partnerships, and improving access to FACT services. Topic 4: Developing and maintaining collaborative relationships with law enforcement that survives changing times. Access to treatment services, staffing, and service models have been altered due to the pandemic. Law enforcement practices have also been altered, in particular training initiatives and reduction in arrests. However, the treatment, service, and support needs of individuals with behavioral health disorders encountered by law enforcement must still be addressed. In this webinar, presenters will describe how community partnerships with law enforcement, such as CIT programs, have adapted to address the needs of individuals in crisis or in contact with law enforcement. Guidelines will be introduced for communities to consider in order to adapt and grow these relationships. Topic 5: 911 and crisis call line integration. While most communities have a crisis call line, most often calls for mental health assistance are made to 911 call centers, resulting in an over-reliance on law enforcement to respond first. To address this, the National Suicide Hotline Designation Act was passed in 2020, which will establish the 3-digit phone number 988 by July 2022 to access trained mental health counselors for calls regarding suicide and crisis. This webinar will explore how existing 911 call centers and crisis service providers can coordinate responses and smoothly transition for the new crisis number. Presenters will discuss current integration strategies as well as the implications for implementation of 988 nationwide. In addition to these webinars, the Early Diversion Virtual Learning Community Series will provide participants with downloadable fact sheets and 1-hour discussion groups with subject matter experts. Join us for this invaluable opportunity to understand how early diversion in the criminal justice system can be implemented and lead to improved individual outcomes and system responses